Hello and welcome to our presentation entitled Collaborative Practice in Person-Centered Care. My name is Dr. Kateryna METERSKY and I'm narrating this presentation for you. In terms of the question that we wanted to answer through our case study is, are patients provided with the required resources, knowledge, and skills to execute the self-care manager role effectively in their own lived context? Through a real-life case study, the purpose of our work was to answer the question, are we pushing the pendulum in the opposite direction when we are inviting and working with patients in close collaborative partnerships as part of interprofessional teams? In terms of the background and significance, METERSKY et al., that is me, in 2021 developed a Constructivist Grounded Theory study on patient roles on interprofessional teams and produced the following framework that you can see on the right-hand side of your slide that talked about 2 patient roles, 4 processes that are required for such role enactments, and the 3 conditions that need to be in place. Why is that of significance? Is because what we're finding is that in real life, those roles, processes, and conditions are not executed effectively. To manage chronic illness, we need to think about the right combination of clinical tools, the appropriate knowledge of patients, and the knowledge that we support our patients with as healthcare providers. So in terms of the case study, this case study focuses on a pediatric patient who has advanced epilepsy that is presented as nocturnal seizures. Once the family member and the patient went to a sleep study clinic to receive a follow-up appointment post the sleep study, the sleep study specialist spent 8 minutes, and I do say 8 minutes, talking about a slew of different specialists, imaging that needs to be done, as well as blood work that needs to be completed and prescriptions that need to be filled for this family to navigate through. When the family member asked the sleep study specialist who is going to assist with such care coordination, the response that they got is, you will have to coordinate all of this yourself, of course. So thinking about that case in further detail for the case analysis, have we gone too far with patient care ownership? Yes, we want patients to be more actively involved in their care. Patients are asking for this themselves. But when we don't provide them with enough resources, supports, and knowledge, are we pushing the onus of care responsibility strictly onto patients now? What we need to do is really think about revising the 4 processes of explain, identify, build, and collaborate, as well as consider and redefine the 3 conditions of flexibility, time, and readiness to be more in line with what METERSKY et al. 2021 intended and found in their study, to be more focused on the patient and positioning the patients with the required knowledge, skills, and abilities to become effective self-care managers of their condition in the community. So in terms of patient roles, as mentioned, 2 patient roles were identified, self-care manager and co-decision maker. But in order for those 2 roles to be executed well by patients, we need to revisit those processes. The first one, explain. If we have unclear requirements of patients, patients are going to develop inaccurate interpretations. So in this case, we need to ask, how do family caregivers best retain information and align our teaching with that retention of information? For identify, we need to identify patients' preferred level of involvement at each and every clinical interaction and visit, and not assume that their level of involvement is consistent across the board. For build, we need to build trusting therapeutic relationships. And finally, for collaborate, we need to be explicit in terms of the encouragement for collaborative care by healthcare providers. When we revisit the conditions, we need to think about flexibility, time, and readiness in terms of the flexibility of sharing experiences, capabilities, and knowledge to establish that collaborative care plan. We need to build time at the beginning of the relationship to really get to know the person behind the condition and what roles they want to execute. And we need to determine for readiness, patient's readiness at the start of the relationship and through consequent interactions on how to become self-care managers. So the key takeaways are that exploring challenges of patients adopting to a demanding role in their care may be propelling them in direction that does not align with collaborative partnership, and collaborative care should be appropriately delivered through the 4 processes and 3 conditions in order for those 2 roles to be successfully executed by patients. Here's our contact information, the link to the METERSKY et al. Study that was discussed in this case study. Thank you so much for listening.